Period poverty is defined as the inadequate access to menstrual hygiene tools and education. Most of what we know about period poverty comes from industry and organizations, rather than peer-reviewed studies. However, we do know that period poverty is on the rise, and some reports have published that nearly a quarter of all students in the U.S. are affected. We also know that period poverty disproportionately affects lower income and students of color. We also know that inequities persist even when menstruators can afford menstrual products. The Menstrual Equity Framework was intended to acknowledge the need for changes in public policy to overcome period poverty. We know that research is critical in informing policy, and qualitative research enables a deeper understanding into the lived experiences of adolescents who menstruate. So in our study, we used a menstrual equity framework to better understand the experiences of adolescents who menstruate and to identify key areas for improvement. We interviewed 20 adolescents who either had Medicaid insurance or had reported period poverty at a prior medical visit. We also asked our participants to film a brief video diary that was played back during the interview and used as a prompt for further discussion. The themes that emerged from our study can be categorized into 3 key areas for improvement, and I'll let you hear a little bit from the youth about those themes. The first key area for improvement was in quality of life. In addition to being limited by menstrual pain, the youth in our study noted a number of systemic limitations that make it harder for them to function on their periods, such as restrictions in bathroom allowances during the school day. As a result of this and other limitations, youth in our study wanted us to do more to normalize menstruation.
If somebody said to me, what one thing you would change about periods, I would say the mental stigma that society has on periods.
The second key area for improvement was in education. Youth in our study believe that lack of education and misinformation perpetuates menstrual stigma. Youth want more information about their periods, and they want it to be distinct from discussions about sex. And when this doesn't happen, youth are turning to social media for this education.
I've learned much more about the body and people off of social media, like TikTok and stuff, way more than I have in school.
And our last key area for improvement is in access and affordability of menstrual products. All of the youth in our study reported feeling the financial burden of menstruation, and they want us to do more to increase access and affordability of these products, particularly in public restrooms, school bathrooms, and medical offices.
Nobody really talks about how much money people put out into buying pads.
I do think they should give it away for free, and I think it should be in the bathroom so you don't have to ask for them.
We know that there are benefits to investigators, adolescent collaborators, and the field of adolescent medicine when youth are involved in the research process. Involving youth in this research process not only contributes to the quality and integrity of the research, but it also empowers our youth participants to be advocates for their community. We invited all of our participants to join a youth advisory board, where they were asked to assist in the interpretation and dissemination of the results. Overall, our research found that youth want more advocacy and education around menstrual equity. Our research team and participant-led youth advisory board plan to share these data with educators and community leaders to inform policy and best practice guidelines around menstrual equity.